On the 15th of May 2024, President Ramaphosa signed the NHI Act, a proposal to effectively nationalize healthcare and end private medical aid schemes and insurance. Now, the Act turns the state into virtually the sole payer of your and everyone else's healthcare costs. But if the state pays for all healthcare services, the state gets to control all healthcare services. And as the central decision maker in healthcare funding, the state decides when you get treated, if you get treated, and at what quality of care. This impact on patient care is worrying enough, but the effect on healthcare practitioners and businesses is just as concerning. The NHI would put healthcare practitioners and businesses under extensive direct and indirect state control, determining how they must operate, the prices they are paid, and even who they can treat. Now, independent private healthcare businesses and practitioners would become mere functionaries in a state system, stripped of autonomy to run their practice and make their own decisions. Now, these conditions would understandably push healthcare professionals away. Many desperately needed practitioners would leave the healthcare sector altogether, retire early, or emigrate to work in healthcare overseas. And fewer talented young people would choose to pursue careers in medicine. The net result? A persistent, worsening shortage of healthcare practitioners to run functional facilities, long waiting lists, declining quality of care, and rising costs. What about the economic implications of the NHI? Numerous credible estimates put the annual costs of the NHI at around 1 trillion rand or higher, around half of the state's entire annual budget. Now, this cost alone is economically paralyzing. It would entail crippling tax increases on businesses and households, unsustainable government deficits, major defunding of other state departments, and cement the government's path to financial ruin. The economic burden on households and businesses would be crushing. Inevitably, the state would have to lower such impossibly high costs, and the only way the government could do that is by cutting the quality and availability of your healthcare. The current status of the NHI is that it has been signed by the president, but not yet implemented. The medical schemes, hospitals, and healthcare practitioners continue to operate as normal, and would likely continue doing so for quite some time. NHI opponents must use this time strategically to their advantage. And given the good prospects for resisting the NHI, stakeholders need not simply accept the state's harmful healthcare proposals. The state's hand is weaker than it pretends, for the following reasons. First, as discussed, the proposed NHI system is unviable on economic grounds alone. The NHI is also deeply unpopular among medical companies, doctors, millions of private medical scheme members, and private healthcare patients. Widespread voluntary non-cooperation with the NHI system by medical practitioners would render it largely defunct from the outset. Further, the NHI Act is legally challengeable on multiple constitutional, procedural, and practical grounds. And several parties, including Sakeliga, are mounting concerted and complementary litigation from different angles. Sakeliga's litigation on the NHI makes essential contributions from a business perspective. And now is the time for firm, resolute opposition to the NHI, not hasty concessions or compromises. A healthy population and flourishing healthcare sector can only be achieved with higher productivity across the economy and the freedom for healthcare businesses and non-profits to trade, invest, and innovate for the needs of patients. The NHI turns this logic on its head by adding tax and regulatory burdens that will ultimately reduce productivity and destroy one of society's most important services. We must protect the independence of healthcare providers to ensure they can continue delivering and expanding quality care. Independent businesses and organizations should remain patient and undaunted, avoid unnecessary compromises, and support well-structured opposition against the NHI. In doing so, they will play an essential role in crafting a flourishing environment for healthcare. I'm Russell Lamberti, Executive Director and Chief Economist at Sakeliga. Subscribe for future videos and view the link in the description to support our work against the NHI.